Hello, everyone. Welcome to this month's A&D Medical Live Q&A show. It's April 2nd, 2026. And on this channel, we answer all of your cardiovascular health questions live. Anything blood pressure related, we answer it on our live Q&A show. My name is Abraham. I am a certified advanced clinical practitioner and the lead of the YouTube channel here at A&D Medical. On this channel, we create science-backed content focused on cardiovascular health and well-being. We go live every first Thursday of the month, so mark it in your calendars. We're going to dive straight into your comments. So just a bit of housekeeping before we begin. All the questions I answer here are submitted by viewers like yourselves through comments on our videos and social media. So if you ever have a question about blood pressure, about heart health, or anything else we cover, just drop a comment and I'll try and include it in this live show if I can answer it, because we've got loads of questions to answer. And if we don't have time, I will answer it in next month's episode. Just to let you know, I have two tabs open. So I'll be flicking back and forth. So if you do leave a comment and I don't reply back straight away, I won't miss it. All right, but I'll get back to it. A few comments already. Hi, happy April from D Henderson. Happy April to you as well, D. Thank you for tuning in. And we've got a good amount of viewers at the moment. So yeah, I'll get started. And if anyone leaves a comment whilst I'm talking, I will get back to you. So the first comment is from Peter Paper. Comment is, what's the best breathing trick to instantly lower blood pressure? And this is a great question. So I want to get kind of a bit serious on this one first. And I want to be really clear on this because there's a lot of misinformation online about breathing techniques and try this breathing technique to instantly lower your blood pressure, etc. So yes, if you do slow breathing, deep breathing, you can temporarily lower your blood pressure. It activates the parasympathetic nerves. It helps you relax, and you'll often see the numbers drop when you take a reading. But here's the problem with this, and I've got a big problem with this. That is not your true blood pressure reading. So when you're trying to get your blood pressure, when you're taking your blood pressure reading, you want to get a true representation of what your actual blood pressure is. If you're doing specific breathing techniques right before a blood pressure reading, or worse, during the actual measurement, you are essentially artificially lowering the number. So I want everyone to remember that. And it kind of creates a false picture. You are kind of trying to show to your provider that, hey, my blood pressure readings are way lower, or kind of, create a false picture in your own head that, yes, my blood pressure readings are good. But in real life, you're not walking around all day doing controlled breathing exercises every time your blood pressure rises. So your actual average blood pressure might be much higher compared to when you're doing these breathing exercises to artificially drop your blood pressure. Your blood pressure reading systolic might be 140, 150 or higher, but from these breathing techniques, you're able to manipulate the readings and lower it. And that really is the number that matters, the real number. That's the number that puts strain on your heart, on your brain, on your blood vessels, on your eyes, day in, day out, on your kidneys. That's the damage that's happening day in, day out. So if you keep breathing, if you keep beating the reading with these breathing tricks, you risk missing high blood pressure that actually needs treating. And over time, untreated blood pressure can cause real damage, thickening of the heart muscle, narrowing and damaging of the blood vessels, damage to the heart attacks, strokes, damage to the eyes, damage to the kidney. And we do have a video on that as well, by the way, that how high blood pressure progresses over time and how it actually does its damage. This doesn't happen overnight. It happens over time, and that's why accuracy matters so much. So what I recommend is you relax when you take your blood pressure. By all means, sit calmly, relax, but breathe normally when you are taking your blood pressure. Do not hold your breath. Do not do these special techniques that you might have learned from YouTube or these other platforms to try and artificially lower your blood pressure. We're not trying to get a good reading per se. We're trying to get a true reading that actually represents your blood pressure. So that's just what I think about that piece of paper. I hope it was helpful. So the takeaway is simple: breathe normally, stay relaxed, measure honestly, because long term, it's far better to know your real blood pressure and treat it properly than to mask it and to deal with the consequences years later. And if you want to know how to take your blood pressure properly, how to do it correctly, I will leave a link to that video in this video at the top at the end. And also, if you actually want to know how to lower your blood pressure naturally through natural ways that actually do help long term, we have loads of videos on that as well, and I'll link that as well. I'm just going to flick back to our comment section. And we're doing good. All right, we've got a good number of viewers on today. So we've got 16 live viewers on at the moment. Hello, everyone. If anyone wants to join the chat, please do. Right, let me get back to our comments that we've got from previous videos. So the next comment is from Craig Holmes-M5C. So it's quite a long comment. So basically, Craig said that his Samsung smartwatch seems fairly accurate after calibration. And I think it takes his blood pressure as well. But a cheaper smartwatch that he tried was way off for blood pressure, even though pulse and oxygen looked okay. He still does use a proper validated blood pressure monitor for his readings with his doctor. That's fantastic. But he does like using his watch over time to track trends. I think he also mentioned as well that his smartwatch actually flagged up potential AFib, which led him to get that checked with his medical provider, and it was actually really helpful for him. And what Craig really asked is, how accurate are smartwatches for blood pressure, pulse and oxygen levels? Can we trust them, or should we still rely on proper blood pressure monitors? All right, that's awesome. Let's get straight into it. So I think they are evolving quite rapidly, smartwatches especially. Wearable devices, like smartwatches, smart rings, they're becoming more advanced. But according to the American Heart Association, these new cuffless technologies, they do show promise for transforming how we monitor health in the future. And they're particularly useful, though, for things like tracking patterns over time, increasing awareness of your health, and in some cases, being able to detect those early red flags, like you said earlier about the AFib, with like an irregular heart rhythm. So for things like heart rate and oxygen levels, most modern devices are reasonably reliable for everyday use when using them properly. So smartwatches and smart rings. But blood pressure is a little different. So the AHA, so the American Heart Association, I'll just get on blood pressure because I did put it here earlier. So they don't measure using an inflatable cuff like how our A&D Medical blood pressure monitors do. So how they work instead is they actually use algorithms and indirect signals, and often require regular calibration against a cuff-based monitor. So even with calibration, there are still challenges of accuracy, consistency, and standardization across different users. So that means the readings can really vary depending on things like position, movement, temperature, individuals' physiology. And because of this, the American Heart Association makes it quite clear that these devices, so smartwatches and smart rings, they're not a replacement for clinically validated, blood pressure monitors that are on the validated device listing. So right now, the way we use these devices clinically, I'd say it's great for trends and awareness because we tend to wear our watch all day. So it's really good for just monitoring things in the background. And like you actually said, Craig, you described the ideal setup. You've used a smartwatch to track patterns and change over time, but rely on a validated blood pressure monitor when accuracy really matters. And if you do actually want to see a video that we did, I think it was a couple of months ago, where I actually did an experiment comparing smartwatches and smart rings versus an A&D Medical blood pressure monitor, and really showed you the difference in blood pressure readings that they were giving and pulse readings that they were giving compared to an actual validated home blood pressure monitor. And the results are pretty eye-opening. And again, I will leave a link to that video at the top, at the end of the video. You'll be able to get onto that if you want to watch it. So yeah, perfect. Please do that. I'm just trying to fit this blood pressure monitor on my table. Awesome. Just going back to the comments. We've got a message from Kells Welsh Angel. Thank you. Thank you very much. Thanks for tuning in and joining our live show. Lady H, thank you for the helpful tips. Well, thank you very much. I'm glad that people are enjoying our live show. Honestly, I'm genuinely speaking, this is one of my favorite parts of the month, is doing the A&D live shows. So thank you so much for tuning in. All right. So, before I move on, there's a comment that's just come up actually. If my wearable, so this is a comment from Megan Kleckner, 2949. If my wearable is reading consistently high, what would you recommend as a next step? If your wearable device, so because we've just been talking about smartwatches and smart rings, if your wearable device is showing consistently high readings, I would 100% recommend the first thing you should do is get a validated home blood pressure monitor. All our A&D Medical blood pressure monitors are on the validated device listing. Take some home readings. So what you should do is take 2 readings every single day. So 2 readings in the morning at the same time, 2 readings in the evening at the same time. Average those readings, do it for 7 days, and then show that to your medical provider. Also, a really good tip as well is we actually have the A&D Heart Track app as well. So the A&D Heart Track app, you can download it on Google Store, on the Apple iStore. It's completely free. I love using it because I'm able to put all my readings on there, my blood pressure readings, our oximeter links to that as well. All our Bluetooth devices link to it. So all your readings can go on there automatically, but it's also a really good way to keep track of those readings and then show it to your medical provider as well. So if you are getting, a message on your smartwatch or smart ring saying, hey, your blood pressure might be a little high, definitely take some readings on your validated device list, on your validated blood pressure monitor, and then show that to your medical provider. So I hope that helps. All right. We're doing well for time, guys. I'm really enjoying the comment section. Hi, Doc from Gus Rivers, NG40W. Hi, thank you for tuning in, guys. Let's continue on. If anyone comments after I've gone on to the next question, I'll come back to you. So please do not worry. I'm just going to take a sip of water. Okay, right. We are doing well. So the next comment I have is from Terence Meredith, 3066. Hi, thank you for the video. It was really informative. I've had to buy a BP machine and I've been told to monitor my blood pressure 3 times a day. Could you tell me what time is the best times to do them? I'm 75 years of age and retired now. Many thanks, Terry. Well, Terry, thank you for your comment. This actually links quite well with the comment from Megan Kleckner, actually, that I just mentioned about taking how often you should take blood pressure readings. So first of all, timing makes a big difference to get accurate blood pressure readings. So usually in clinic, I generally recommend patients to take their blood pressure twice a day. So you're going to take it once in the morning after you've woken up and you've been to the toilet, you've been to the bathroom, and before eating or taking any of your medication, and you're going to take 2 readings. I like to take 2 or 3 readings and then average them out, take them a minute apart and then average them out. And then again, you're going to do it in the evening when you're relaxed, not straight after any activity or any meals, and you're going to take 2 or 3 readings and then average them out. Again, if you don't have the A&D Heart Track app, download it and then store it on there. Now, in case you've been told by your provider to check it 3 times a day, there might be a specific reason from your medical provider to do that. So if they've actually asked for that, a simple way I'd structure that is morning, midday or early afternoon, and then evening. So again, you're going to take 3 readings in the morning, 3 readings in the midday or early afternoon, 3 readings in evening. You can take 3 or 2 readings. So really, whatever's easy for yourself, because the main thing is you don't want it to be too difficult for you every single time you're taking the blood pressure reading. One of the features actually on that I'm actually thinking about, if you do have the A&D Medical Precision Check Pro device, the one in my hand, this actually has a feature where it automatically takes 3 readings, and you can set it to take it a minute apart. You can set it to take it 30 seconds apart. So it makes that a lot easier for you, and then it averages it out. It's called TriCheck technology. It's our trademark technology at A&D Medical. So some of our devices have that on new devices. So it would be really good to switch that on, especially in your case, Terry. So yeah, most importantly is making sure you're rested when you're taking your blood pressure, sitting comfortably, your feet are flat on the floor, and not talking during the measurement. So the takeaway is same time each day, morning and evening as a baseline. And if your doctor's asked for 3 times, stick to that plan. And by the way, Terry, if you do want a full step-by-step guide on, how to take your blood pressure properly, using a blood pressure monitor, common mistakes I see patients making, etc., I will leave a link to that video as well, so you can give it a watch, because I think it would be quite handy as well. All right. Okay, we've got another comment. I'm just flicking back onto the comments, guys. I'm loving how active our chat is today. Me more 69. Thank you for everything you do. Thank you for everything you do as well. Thank you for commenting and joining our live show today. This is awesome. I'm really enjoying the live show today. Thanks, guys. Thank you for all the love as well that everyone's sharing and the positivity. So the next comment, I'm just going to move straight on to the next comment because we have a few more to get through. So this one comes from kindness-E3V. And it's on our video on how to use a wrist blood pressure monitor using the A&D Medical wrist blood pressure monitor. The comment was, a different video said that the wrist monitor has to stick directly over the artery at exactly the proper length from your hand, and your wrist has to be kept exactly at heart level, and you have to have no calcium buildup in your arteries for it to read accurately. What are your comments on that? Thank you for your comment. That's a great question. There's a lot of mixed information online, and that's why it's always important to make sure you're getting your information from credible sources. So firstly, you don't need to play, well, our A&D medical blood pressure monitor, our wrist monitor, you don't need to place the monitor directly over the artery at an exact perfect spot. Our wrist monitors, they use oscillometric technology. They detect pressure waves through the cuff. So they don't rely on pinpointing the artery at the exact location the way a stethoscope does actually. So when I'm taking your blood pressure using a stethoscope, I'm trying to pinpoint that exact location so I can hear it. If the wrist, however, is too high, because in the video, I'm teaching the viewers that you have to sort of, rest your wrist on the table and have it held up like so. If your wrist is too high from the heart level, basically, your blood pressure is going to look lower. So it's going to give you a lower reading. And if your wrist is too low from the heart level, your reading looks higher. So that position and resting your elbow on the table is really important. Third point you mentioned, you do not need perfectly clean calcium-free arteries for a wrist monitor to work. If that was true, then almost no adult over 40 could use one. So what actually does matter is correct wrist position, which you did mention. That's really important. Obviously, staying relaxed and still resting 5 minutes before. So to summarize, no, you don't need exact artery placement. Yes, the wrist must be at heart level. That was a great point. No, calcium does not stop accuracy. And yes, validated monitors, definitely work well if they're positioned correctly. So I hope that is helpful. Just going back to the comments section, I'm just gonna have a sip of water as well. It's a really nice day, by the way, here in England today. It's very sunny. So tell me how you guys are doing wherever you are in the world. I'd love to hear what the weather's like where you are and what you're up to today as well. So join us in the conversation because the chat is really active today. So SCP-731, always good to hear your expertise, good sir. Thank you very much. I'm glad that you are enjoying the content. So I'm just going to move on to our next comment. Okay, so this comment is from Stevo93. What foods are good for the heart? That's a great question. So the American Heart Association recently actually updated its guidance, and the message is simple. Healthy eating is about patterns and not one magic food. And that's something I'm always telling my own patients in clinic. So you want to start with vegetables and fruits, especially leafy greens, berries, and colorful vegetables. These support healthy blood pressure and healthy blood vessels. You also want to choose whole grains, such as oats, whole grain bread, brown rice, quinoa. They help lower LDL cholesterol, which is really good. If you want to lower LDL cholesterol, that's a good thing to do. You want to prioritize healthy fats, so olive oil, nuts, seeds, avocados, and oily fish like salmon or mackerel. They really do help reduce inflammation and improve cholesterol balance. For protein, you want to be, leaning towards plant-based options. They're very good. Plus fish and lean poultry, and limit processed meats. Really, that's the main thing. You don't want to be having a lot of processed meats. And just as important, you want to cut back on salt. And I'm going to touch on salt a little bit as well in a minute. But you also want to cut back on added sugars, ultra-processed foods, which drive high blood pressure and heart disease risk. Now, the thing about salt is, I always feel like patients tend to prioritize salt as this thing that this is the only reason why I have high blood pressure. I'm having too much salt in my diet. And that is not the best way to think of it. So yes, salt increases blood pressure, increases systolic and diastolic blood pressure. We know that. There's a lot of research supporting that. However, I can't tell you the number of times I've had consultations with patients and they tell me, I've cut down all the salt. I don't add any salt to my diet whatsoever. Why is my blood pressure still high? And the main reason for that is that a lot of patients then tend to not look at the other things that they're doing as well that might be pushing up their blood pressure. They might be living a very sedentary lifestyle. A lot of us do. We go to the office, we sit in the car, we drive to the office, we work for 8 hours, we then sit back in the car, drive home, sit on the sofa, we sit down to eat, and then we get to bed and we sleep. And it's like the same thing over and over again. So a very sedentary lifestyle can make your blood pressure go higher. Insulin resistance, we know that increases blood pressure and increases the risk of hypertension. So if you're having lots of processed meals, if you're having lots of ready meals, if you're having lots of takeouts, these are all notoriously high in refined carbohydrates as well. Yes, they've got lots of salt in them as well, but that could also be pushing up that insulin resistance. If you're having lots of sugary drinks, if you have a Starbucks every single day and it's not just a coffee, but it's a mixture of all these sugary syrups and stuff, which taste great, but in the background, they are increasing that insulin resistance. And these are the sort of things that quite often patients don't think about when it comes to blood pressure. So yes, salt is important, but I just wanted to give that little side note for you guys to tell you that's how I think in clinic when I see patients. So it's just really important. So simple takeaway from that answer, mostly plants, whole foods, really important, healthy fats, and minimal processed foods. And if you have high blood pressure, or heart disease, obviously always important to get personalized health advice from a medical provider. We also do have videos on the channel going through tips and tricks and stuff that are really helpful at lowering blood pressure and keeping your heart healthy. So I hope that was helpful. All right, so I'm just gonna go back to our comments. All right, so next comment is from Laguna Foster. I'm just gonna have a sip of water. How does outdoor, and this is from Laguna Foster, how does outdoor temperature affect blood pressure, such as a really hot day? That's a fantastic question. So outdoor temperature, well, temperature in general is going to affect your blood pressure, okay? But the thing is, we don't live outside, we live indoors. So yes, but I guess that would make your house warmer. The most important thing about blood pressure is keeping the temperature in your house consistent. So you don't want your house to be too warm all the time, and you don't want it to be too cold all the time. If it's too cold all the time, your blood vessels basically constrict, so your blood pressure goes higher. It's a way to conserve heat. That's what the body does. And if it's too warm in your house, your blood vessels are going to dilate, and your blood pressure readings are going to be lower. Okay, so that answers your question a bit, Laguna, about what does warm temperature do. So it's really important to try and keep your room temperature, your home temperature, consistent. So if you have a thermostat, generally I recommend keeping the thermostat at about 20 degrees Celsius. That's about 69, 70 Fahrenheit. One other thing as well to mention as well, that this is one of the features that I love about the A&D Medical Precision Check Pro device. This is the one in my hand right now. It's one of our newer devices. Is it actually has an inbuilt thermometer. And whenever you take a reading on this device, it also stores the ambient room temperature at the time. And that can be really helpful, because all of a sudden, if you've got a bit of an outlier and, you're like, why is that much higher than I usually get? Or why is it much lower? And you can see, for example, the room temperature was 85 Fahrenheit, for example, and, you're having a much lower blood pressure. Well, that could be the correlation there. Or if it was, if your blood pressure was much higher and the room temperature was much colder, like, I don't know, 60 Fahrenheit or something, then again, there could be some correlation. And this is the sort of stuff that our engineers at A&D Medical, are always developing. They're always looking at new technologies and adding new features to our devices. And that's one of the reasons why I love our A&D Medical blood pressure monitors so much. They really are the best blood pressure monitor out there, and they are genuinely a workhorse. I've said it in previous videos as well. I still have my A&D Medical blood pressure monitor that I first purchased back when I first graduated back in 2013, and it still works perfectly. And they really are the type of blood pressure monitor that, if you look after it and you treat it right, it will last you a lifetime. So that's just a bit about A&D Medical. But yeah, the Precision Check Pro device in my hand, that one has the ambient room temperature thermometer as well in there. So perfect. So looks like we are done for time, guys. Thank you so much for watching this month's A&D Medical live Q&A. If you're watching this video after it's gone live, please do not worry. There will be a new episode every first Thursday of the month that you can click, you can watch. If I haven't answered any of the questions on today's chat, I will answer it in next month's episode, so please do tune in. And obviously, if you're watching this, like I said, if you watch it after it's gone live, leave a comment still. We'll answer it in next month's episode, or leave a comment in any of our videos. We will answer it in next month's episode. Please subscribe to our channel to stay up to date with our daily health videos. We're posting daily health, blood pressure related, cardiovascular videos, so stay up to date. And as we always say at the end of our video, A&D Medical, discover precision. Thank you so much for watching and have a great day.